We just did a survey of over 1,300 doctors, and we were asking about the problems that doctors are facing at the moment. And 8 out of 10 of those responding said that they knew other doctors with mental health issues, such as depression or anxiety, but at the same time, again 8 out of 10 said that those very same doctors in need of support wouldn't access that support, would be very reluctant to come forward because they were worried about stigma and discrimination and worried about how this would affect their work and their career. And so, what's emerging from the study is a real need to provide accessible support to doctors, confidential support and anonymous support, because there is this real stigma, and nobody should feel ashamed to ask for that support.
What we're seeing is a far greater level of severity and far fewer support networks for GPs, and actually much more external pressure. We're treating the symptoms and not the cause. We don't have a culture anymore that values colleagues in medicine. Nurses are falling pretty much by the same wayside because the culture is all about cost.
The greatest trend we've been seeing year on year is increasing logarithmic growth in cases going to the GNC, for example, which is probably the most stressful process that our members go through. And we are pleased, of course, that the GMC are now beginning to take steps to try and reduce the stress that the processes have.
I think one of the things that adds to the stress is the recognition that you're getting into unsafe territory. We're regulated to death, almost literally, really. We're losing significant numbers of doctors in there from 55 onwards. Very few are staying. But one of the factors that keeps being fed back to us is nobody wants to end their career in front of the GMC.
We read in the Times the other day about somebody's son who was a junior doctor who lived here and was disenchanted and just didn't want to stay. So went to America, and he's there doing double the number of hours. He's paid exactly the same, but he's loving it for the simple reason he's valued.
Number of sick days, that adds up, and we're reliant on a locum workforce that is further strained. I mean, I work with colleagues both in hospital and out of hospital, and we're all stuck in this, the rostering system that needs to be plugged by people. But clearly there's an economic argument to be made in that if we were to quantify the number of sick days related to folk going off ill and sick, and particularly those early warning signs that you've so eloquently pointed out, surely it's a bit of a no-brainer from
and it's also a no-brainer that losing a doctor altogether after £500,000 worth of training is not a very cost-effective approach.
That's more than that, isn't it?
We don't need to reinvent the wheel, okay? And that absolutely we can learn a lot from other industries that are safety critical.
All of this worry about letting colleagues down absolutely is true. So you just keep going until you crash and you have a breakdown, and then all sorts of things happen.
What's really interesting is what you think you'll do if you're unwell and what you actually do when you are unwell is very different. And I think that's what we haven't caught on to.
Would you like to read out your advertisement from the Vital Signs?
Wanted, medical staff, high academic achievers only with strong perfectionist and self-critical traits. Successful candidate will have had 5+ years in party-fueled student culture, followed by sleep deprivation and long hours in their 20s, regular exposure to death, loss, human misfortune, never-ending exams, lifelong study, constant onerous responsibilities for other people's health and well-being, strict hierarchical conservative training with a hint of bullying and intimidation, easy access to pharmaceuticals.
If somebody reads the Vital Signs document and says, oh crikey, I know that this is happening to me, or this happened to my guy who does the surgery down the corridor from me, where would they go?
I think there must be examples we can look at where people successfully protect themselves, or the environment protects them, or something protects them, to be able to draw upon that for wider benefit.
Yeah, the BMA Doctors for Doctors service, which is fantastic. is used, but it's not used tremendously.
Well, you want a comprehensive patchwork, don't you? Not one with big holes in it.
Yeah. And you also want one where people feel confident to approach it. When people are going through difficulty, there is financial support from the RMBF, and so if someone's going through a difficult period, we can support them during that period and back to work, which is crucial. But also we have 250 highly trained volunteers across the country, but maybe there's potential that we can do more with our volunteer network.
The MDDUS is very aware of the stresses that doctors and dentists indeed as well, and students encounter, and it's helpful for us just to learn more about that, and also to have a better idea of how we can help and to direct them to people who can support them in that way as well.
I suppose one thing that I do feel quite strongly is that of course it's really, really important to highlight this, but it's also really, really important to highlight that medicine is a great career. I think to give a consistently negative message is going to cause problems. I think we've got to season our concerns about the well-being of the workforce with a much more enthusiastic rallying cry to people to do medicine. It's been very interesting, and I just wondered if we might get together in a year's time actually in the same group and see where we've got to. It'd be interesting to review changes and progress. Anyway, thank you all very much for coming. It's been a real pleasure, and kind of you to give us the time.
Thank you.